All right. So hi, I'm Charmain Jackman. Welcome so much. I'm the founder of InnoPsych Inc., which is an organization that's on a mission to disrupt racial disparities in mental health. And some of the things that we do is we have a national directory for therapists of color. So if you are a person who's looking for therapy and want, in particular, therapists of color, we invite you to check out our directory. And if you are a therapist of color, we invite you to join our directory. It's free and no cost. And then the other service we offer is provide engaging conversations like we'll have tonight around mental wellness and mental health. And our goal is really to change the conversation around mental health. We really want to create a normalcy around it for people to just engage and talk and express themselves, be able to talk to family members, friends. We really just want to disrupt some of the stigma around having those conversations. Last week, I brought my mom on. So if you were here, you heard us talking about mental health and how it has impacted and entered our family. We have two wonderful speakers lined up for next month, for the rest of the month. We're really focusing on Black mental health this month. In March is Social Work Month, so we'll be highlighting some social workers of color in the community as well. So again, excited to have you here. The format for tonight, this is the first time I'm doing this. I've been doing this, started last year, April, and I typically have guests on. So this is the first time it's just me. So I'm excited to have this conversation. So what I plan to do is to share some slides, not too much, around some of my thinking and my perspective of where the Black mental health is. But I really want to have a conversation. So, I have some questions to help us start going, but I really want to just have a discussion about what your thoughts are, what you want to see therapists and Black therapists, what do you want to see the field enter? So that's going to be the format of the conversation. Did somebody just share their screen? Oh, how did you get to do that?
I did not mean to share my screen. I'm sorry.
Okay, who only host? Hi, Jennifer just wanted me to know she was there. Hi, Jennifer. So welcome, Jennifer. So I will actually share my screen right now to get us started. And definitely please feel free to post questions or comments in the chat as well. All right, so let's start here. All right. And great. So again, our conversation tonight in honor of Black History Month, in honor of Black History Month, we're really going to focus this conversation on Black mental health. And the topic, the state of Black mental health, looking back and looking ahead. And I actually use that tagline because part of my, the logo for InnoPsych is the Sankofa. Who knows the story of the Sankofa bird? I see some head nods. Okay. So I'm actually going to share that story because it's so central to the work of InnoPsych. So the story of the Sankofa is an African folktale. The story begins with a bird named Sankofa, who grows up in her community, being confident in herself and loving life. One day, she decides to sneak away from her village. When she does so, she meets a bird who insults her and causes her to doubt herself. Sankofa has to return to her village in order to find herself again and confront this voice of the big bird. She is supported by all of her friends and ancestors. And when she returns to the bird with her own sense of self-knowledge, the other bird disappears. When Sankofa goes back to her village, her image is carved so that other youth in the village can remember her and her story. Because she had forgotten from where she came, Sankofa was carved with her neck turned backwards. So that's the story of Sankofa, and how it connects to InnoPsych is it's really about, our mission again is about bringing healing to communities of color. And so I know the image is kind of small here, but our bird has a lavender leaf in its beak. And actually, I really love Sankofa. So this is one on my wall here. And it typically has like a seed or an egg. There's always that symbol. And the idea is that, you're bringing from the past seeds to plant for the future. And so with InnoPsych, our goal is we're bringing healing so we can encourage and support future generations around emotional wellness and healing. So I want to transition with some stats. Um, and so this is a this is a graphic that was taken from Mental Health America. It's a national organization that does a lot of content around mental health, and one of the things they've started to do is actually they have data on different cultural groups. So this is one that they have specifically about African American and Black folks in the US. So here you see in the graphic, you see, let me do my annotation here. You see the United States. So Black and African Americans represent a little over 13% of the population. But the data show that they're overrepresented when it comes to mental health. And so in the past year, and their data talks about these things every year, about 16% of people, of Black folks, report having some mental health conditions, which translates about 7 million people. And they give another graphic or idea of think about the populations of Chicago, Houston, and Philadelphia combined. So that's what we see in terms of mental health um, in the United States and what those numbers represent. And what I wanted to talk quickly about, what are some of the factors that impact Black folks? And I'm going to go to specifically have Black women, Black men, and youth. And, I want to make sure we're including women and people who identify as women in the work and in the definitions. So many of us are impacted by childhood trauma, complex stress that comes from racism, sexism, police brutality, workplace dynamics, and exposure to systemic violence. We're often underdiagnosed, undiagnosed, untreated, misdiagnosed, right, in terms of mental health. And a lot of that comes from the idea, as a psychologist, a lot of the theories did not consider that impact or the lives of Black folks in when they were formed or created. And so the way that we express our mental health and things that might be impacting us or stress weren't originally considered. And so we're often left off in those considerations or those definitions. And so that impacts our feelings of worthiness and creates a sense of hopelessness in a country. And we can see how that's erupted over this year, over the last year in response to COVID as well, seeing the racial disparities in how people were impacted by COVID, the racial violence. So these are systemic and community experiences also can have those compounding impacts on people of color and women and Black women in particular. In terms of Black men, we're seeing similar systemic, right? Because we're all living in the same society. And so the things that are impacting our families often, are not unique. But some of the additional, I included police violence. We know that both men and women are impacted by police brutality. Oftentimes we see more Black men in the stories and in the news. I know a lot of the work by Kimberly Crenshaw has highlighted that intersectionality and how sexism often plays into that. But similarly, Black men are often underdiagnosed, undiagnosed, misdiagnosed. for many of their mental health or just emotional health functioning in particular. We see that they're often overdiagnosed when it comes to psychosis and schizophrenia. I've been interested in reading some work. It's not a Black man. His name is escaping me, but he talks about the psychosis. Um, what's the name of the book? I'll think of it. But his research is a lot around how the change in what around the 60s, went around the civil rights, how there was a change in how schizophrenia and psychosis became more diagnosed in Black men. And originally you'd see it more in white women. And around it, he really connects some of the work to the civil rights movement and that dual consciousness and that fighting back. And so that rage and anger and the protest, that is it, the protest psychosis. And that how that then started to be connected to Black men being overdiagnosed with psychosis. We also see toxic masculinity impacting Black men in particular, their ability to express their emotions, how they're socialized, the demands that are placed on them in terms of responsibility for family, and things like that. So those are some of the systemic factors that we see impacting Black men. And then for Black youth, and I'm going to just giving you some of the highlights, but I really want to make sure we have just some things that to cover, but really, again, a lot of it will be our conversation with each other tonight. So for Black youth, again, similar exposure to community violence and trauma, experiencing racism in educational systems and toxic school environments. We're seeing Black youth particularly have higher rates of suicide attempts and completed suicides when compared to white youth. Overrepresentation in the juvenile justice system. And we see where often, someone who's worked in the court system, in the juvenile courts, I would say well over 90% of the youth who came through the courts were Black youth. Again, that overrepresentation in the system. And we see that, working in schools, again, have context working in a high school as well, that you're often seeing where white youth are given more opportunities for remediation, or diverted to counseling and treatment, where Black youth are diverted towards the juvenile justice system. We often see an overdiagnosis of behavioral disorders in Black youth. So their behaviors are quickly characterized as behavior disorders versus depression or other internalizing behaviors. So one of the poets that I really love, and she's kind of inspired some of the work, and the title for this talk is Maya Angelou. And her quote is, "My mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and style." And so as you think about thriving and some of that data that I just shared, we see that, when we think about what we see in terms of how Black people actually use mental health services, particularly therapy. This data is from National Alliance of Mental Illness, and it's a little old. It's from 2015. I think we're seeing some improvements in utilization rates, but not too far off. But back in 2015, the rates were for Black folks. This has all the multicultural data. When we look at Black folks, we see that around just over 16% of Black people with a mental health diagnosis will actually seek treatment. So the counterpoint to that is 90% of Black people with a mental health diagnosis will not seek treatment, right? That's huge. That's really huge. So I want to pause there and just ask, what does thriving look like for you? And are Black folks thriving? So we'll open up the conversation with these first two questions. And what I'll do, I will I can post the questions in the chat, and I'll stop sharing the screen so we can see each other and really kind of have a conversation. So I invite you to raise your hand. You can post a comment in the chat, or you can simply unmute yourselves, and I will try to keep track of who has raised their hand. So, and Niall, I don't know if I pronounced that right. Thriving is taking up space without feeling guilty, especially in the workplace. I like that. Destiny.
Yeah, thriving for me is overcoming the traumas of my past, living with a mental illness, and surviving to the point of being able to give back. That's thriving to me, that I'm healed and I'm at a point where I can give back to my community from the pain that I felt. So that's thriving to me.
Okay, so I'm going to repeat that because that is very helpful. So thriving is not only healing for yourself, but then being in a place where you can give back.
Yes.
All right. Okay. Who wants to add to that or add another comment? Alan, go. Alan.
Thank you. I didn't see a hand raise icon on the bottom of this thing.
That's okay. Yeah, some people have it. Some of them it can be hard to find. That's okay.
But you said a number of things in this like short period of time, and I think like
I know, right? It's a lot.
Yes, but a lot of it needs to be clarified. That's a problem. Like if you, I can start with this 13% number, which I think is the percentage of blacks, African Americans alone, without all these other groups that are here, is much higher than that. So I don't know why we continue to subscribe to that, but that's a side point. I'll go right to your question, and I think when you start talking about thriving and what does thriving mean to me, I mean, then you come off with all kinds of different abstractions because thriving is going to mean different things to different people. If you're talking about, because you have thriving as an individual, you have thriving as a group. And I think what you mean in this particular case, is what does thriving mean about as a group? And that's very important because first of all, I think that, as African Americans or people of African descent, one of the problems is that we can't be healthy in the paradigms of using the paradigms of psychology or psychoanalysis because those paradigms are Eurocentric and they're based on certain things, okay? They're not communal. So if we look at it from the communal sense, there was an African psychology. Freud and others borrowed dream theory and all these kind of things from African shaman. But in the African context, one did not just look at the mental illness of an individual, the entire family was looked at. So taking that into consideration, I'm going to think, I think that what you probably mean is for blacks is thriving has to be thriving together. And that's going to be very difficult, because of the loss of identity that we have had. And that loss of identity is directly connected to the loss of psychological malleability. And then when you're surrounded by all these other forces, which bring on all this other stress, it's very difficult for an individual or for a group to survive. So that would be, what I think, what striving looks like. And if you ask the question, have Black people or have African Americans thrived? No, they have not, because they're still struggling with their identity. I mean, and the vast majority of them either don't know who they are, they reject what they are, or they look for the identity of the largest, to try to imitate the largest society. And the more they do that, the more they find out they don't fit in. They go for symbols all of the time. So there's a lot of confusion in our community. And I'm talking about confusion among adults, because, and that's very important to mention, because if you're talking about this kind of confusion among children, as a parent, you would stand up and say, well, don't do this, cross the street over here. But basically we're lost because we no longer have even leaders that kind of move us along in one particular direction. So how could one survive there? And the
Thank
only way,
you.
the
Oh,
only way that can be taken care of, I think, is once again by returning to a communal context. And so for me, I think it's very important that when you get Black psychologists or psychologists of color together, we have to start thinking about not just bringing people into a particular office or a particular room, but maybe we should think about going into the community health center, to the community center, and starting regular group conversations with people in the community, in the center. And I would be all for working with anybody who wants to try to get a series of those going across New York City and other places.
thank you. Alan, so you tell me a little bit about, are you a psychologist?
Well, I guess you could say that to some degree. I'm a psychohistorian, and of course, being a historian and dealing with the slave trade and various other things, we naturally get brought into psychology because I don't think you can separate the two. And currently, I'm actually toying with the possibility of getting a doctorate in psychoanalysis, and so I'm at the Boston School of Psychoanalysis, but I do have degrees in psychology and in history. But the problem is the same, whether you're in psychoanalysis, whether you're in history, or whether you're in psychology. There's a Eurocentric paradigm, and we have to deal with that Eurocentric paradigm and put it in its historical context, which is that, for instance, what was done to white women in the psychology then turned around in the colonial context and then said, okay, we're going to now do that to the others out in the colonies. You know what I'm saying? Well, now they're hysterical. Now they're infantile.
Yeah, thank you so much for that historical perspective. And I think I just want to amplify and highlight the point around psychology being created on Eurocentric ideal, which is often in contradiction to our communal upbringing and communal ways that we connect and relate to each other. Thank you for that. I think Sucheta, you had your hand up. And before you start, I'll just read a couple of comments that we had. Marcia wrote, thriving is being able to get and successfully use coping skills to navigate the many challenges and stresses that we face. Someone else, Nayel, also added, it's healing internalized oppression as a group. So very, very awesome points. Thank you so much. I'd love to go ahead, Sucheta. And just say your name, just because in case I'm not pronouncing it correctly. And
yeah, Sucheta is my name, first name. So I wanted to agree with you, Alan, just with our Black people thriving, and I would agree that they're not thriving, because thriving indicates that there's like the environment is nurturing. I think there's the individual qualities and what they bring to the table, but then the environment also has to be a good fit and provide, a space for that individual to grow. And so that has not been there. It's been the opposite. So I would say they're surviving, and yeah, they're not thriving.
mm-hmm. Excellent. Thank you for that. Okay. Any other comments? Any other responses? Laverne said, being free to find and fulfill my purpose without internal or external barriers. Black folks are surviving within the system and trying to make it. That's enough. And trying to make that enough, excuse me. So I'm hearing a lot. I think there's a theme here that if we look at Angelou's definition, we're in that surviving phase, right? So, my next question, I want to share a couple more slides, but what will it take to be able to get to that surviving phase? Sucheta, you're saying the environment needs to be nurturing. Like, how do we survive in an environment that's hostile to our bodies, right? So it's hard to really thrive in that kind of system. Adrian adds, thriving includes having more than enough and overflow that reaches down to others. And I think that connects to one of the comments that one of our first speakers said about being able to heal and then be able to give back. All right. So I'm going to share my slides again. And definitely, you know, continue if there are other things that are coming up for you. Feel free to, you know, jump in or put it in the chat until we move on. So one of the things that, you know, I also want to highlight as we move forward is part of the reason what, you know, we know there are lots of barriers to people connecting with therapy, right? That last slide was, we saw 90% of people don't engage in, Black people don't engage in therapy. You know, the question is, why not? And part of that, you know, we know there's a lot of barriers around the stigma. We also see that this, on the left, we see the breakdown of psychologists who provide clinical services. And I know I'm trying to find data around social work as well and some of the other allied professionals. It's really hard, unfortunately, to find this data. You think it would be a little bit easier. So we see that of all the psychologists who provide clinical services, and this is from 2015 as well, only 3% identified as Black or African American, right? So when you think about, as Alan highlighted, right? Psychology was designed on Eurocentric ideals. And we see that only 10% or less of Black people engage in therapy. Part of the reason that there's this cultural mismatch between who's providing therapy, right? So if you go to a therapist who doesn't look like, who doesn't understand your cultural context, that becomes a problem. Some of the data that I've collected through my work, we find that 95 to 98% of Black people, people of color in general, will drop out of therapy, usually after the first session, if there's a cultural mismatch. And I've had personal experiences where people will share, you know, I had finding a therapist is really hard, right? I've heard people tell me it can take 6 months. A guy told me it took him a year, right? And you imagine at a really tough time of your life and you want to talk to somebody, you finally like peel away from all the barriers, right? All the stigma, and you say, okay, I'm going to do this. And then you can't find somebody, right? And that's part of why we started Psych. But then you go into your therapist, it's like, you know, I'll see whoever, right? You're in therapy with a white person and they are unpacking and dealing with their guilt in your therapy session, or they're causing microaggressions, right? You're not going to want to go back to that. Like, that's not what you're paying for. That's not the experience that you want. So those are some of the anecdotal stories that I've heard from folks. Let's see. All right. One of the I see a lot of push recently is around this decolonization of therapy. A lot of it comes from models from liberation psychology and liberation theory that was started in Central America. And so I think it's a really important place where we're going. And so these are some of the, you know, I've kind of thought about what does decolonizing therapy actually look like, right? And it is one, and we think about the liberation health model, liberation psychology model. One is about naming the oppressive systems in the environment, right? That contribute to poor health outcomes and poor mental health outcomes. And so if we're in a therapy session and we don't ever name that, we continue to just act as though the person, the Black person in the room is having these experiences without taking the context into perspective. We miss a lot, right? And we actually may end up pathologizing the client for things that are system or systemic, right? And so part of the decolonizing of therapy is around naming the oppressive systems that exist. We also need to recognize that clients exist within a community, right? And so again, that highlighting that point of our communal functioning, right? Many of us, we don't operate as individuals within family systems. And so when And the way therapy is often, right, it's individual therapy is a lot. I mean, there are family therapy models, but that individual therapy often leaves families out of that conversation. And so it's really important. How do you bring the client back into their community? Whether they are, I remember when I was in the court, when I would do interviews, I'm like, okay, do you have a faith practice? Can I talk to your pastor, right? So how do you bring in the voices of the community? Those are things that will help support you through your recovery as well. And so we can't act as though they don't exist within a community of supports and resources. And so that's another important point along that place. Also, engaging clients' spiritual and healing practices. What are things that they naturally do? And again, for me, it's all this unlearning of psychology, right? And part of it, I think working with high school students has really helped that, because there are ways in which I was trained that was very rigid. And being in a school really disrupted that for me. But how do you engage a client's spiritual beliefs, right? Again, through my training, I think was just at the early on where you could actually talk, you're given permission to talk about spirituality with a client. But prior, you were, it would seem like counter, like to bring that in. What are clients doing for healing? What do they naturally do for healing? And how can that be part of the process? I tell people, I'm a psychologist, I'm a therapist, so I will always recommend therapy. But I also recognize that there are other things that can work and support a therapeutic process. And so inviting people to bring in what are things that work for them, what are things that work within their community. A lot of the work that we've been doing recently is also connecting and working with Black churches to really create that, permission, or allowing people to be able to practice and balance both their spiritual and their faith practice, along with getting therapy, or even recognizing that mental health conditions that exist. And many of the pastors and clergy have been really supportive and have been trying to figure out how to do that well. Because oftentimes in some of our Black churches, like mental health is not seen as a positive or something that can be part of your healing process. Right? There's almost like a choice. You had to choose God, or you had to choose a healing practice. So, I'm seeing a difference in that. Also recognizing the client as the expert on their life and their circumstances. And so part of that, connect to the last point, is like removing that hierarchy, right? How do we really engage people in the therapeutic practice? And so there are ways where I start off my practice where I tell clients, one, therapy is like a relationship, right? It's very personal. So you need to find somebody who you connect to. And just because you don't connect with me or somebody else, it doesn't mean the process doesn't work. It just means you guys are not vibing, right? So how, really giving them permission, and I say, if it doesn't fit, let me know and I can help connect you to other people. And then checking back in with them to see how it works. But really, how do we inform people about the process and how they can use the process to make it work for them? So I'm just going to go through a little bit of some of the things that we have done at InnoPsych to really kind of support that decolonizing, right? A lot of it is creating programs like this, right? As it is around, how do we have conversations about mental health and mental wellness? How do we start to deconstruct what ideas people have about what does a therapist look like, right? Like, I see many of my colleagues in this room who are Black or people of color. It's like, yes, we are this rich, beautiful place. And so how do we help people see that? Part of the Thriving Thursdays, when I bring therapists on, it is about giving us visibility and being able to share our stories. See, Dr. Mia McNeil, I'm going to call you out. She was one of the guests on our show last year, and talked about her own personal struggle that she had and what she has done for healing. So we really want to create this. We're often, as therapists, we're often in our offices and we don't get time to do stuff in the community, but our clients and our people need to see us and need to see us as people and human, and people that they can have conversations with, and see that therapy is not so mysterious, right? And it can involve your culture. You can bring your culture with you in the room. So these are just some examples of programming that we've had. We've done a lot of work around suicide prevention, and as I mentioned as well, with around the Black churches and faith and mental health. These are some of the therapists on our directory. It's a national directory, and again, it's really about really making it easier and faster for people to find therapists of color. One of the things that we're hearing lately is people are full. There's really been a demand for therapists of color. And so I don't know if any therapists that are out there, if you have any openings, right? We're getting a lot of demand, and it's really exciting. But also in the other places, how are we meeting this demand? And some people have talked about the mental health pandemic is the next next issue. In addition to, we're also really important for us to really make sure that we're providing resources. So we have created a card deck, which really is based on mindfulness strategies. So there are lots of prompts and activities that people can do to promote emotional healing. The middle, this is a graphic that we have on our website that people can download. These are 10 practices that we really emphasize. And again, a lot of it, we really have a pretty big social media presence, and we do a lot of our education there as well. So my next set of questions are around, what do you want to see from the mental health field in the next 3 years, particularly around the topic, the idea of Black mental health? And what initiatives do you want to see in a psych lead, right? We, again, are very, very involved in the community, and I'm looking for creative ways that we can continue to spread the message and give people access to therapy and support. So yeah, so I'll pause here again and open it up again for conversation and discussion. But what do you want to see from the mental health field in the next 3 years? Particularly, we're coming off of, we're still going through this pandemic, and we know we're seeing significant. APA just put out an article a couple of weeks ago that they've seen unprecedented levels of anxiety. So we're seeing people really, really, really suffering and dealing with lots of depression, anxiety, grief, and loss. So we think about communities of color and Black communities in particular. How do we meet the need? When we see like we only have 3% of Black psychologists, I think when I put together the numbers of social workers and mental health counselors, it comes up to about between 10 and 15%. So still really low. So how do we start to meet that demand? What are some creative things that we need to do to help to meet that demand? So I'm going to stop sharing, and I'll post the prompts in the chat, and then we can do that. And these are our last 2 questions, actually. Stop share. Here we go. So post the questions here in the chat. And there's some questions already in the chat. So let me, I'll read that question out. So right now on the floor, we have, what do you want to see from the mental health field over the next 3 years? We have a question from, I see Cassandra says we need more groups which supports healing and normalizing lived experience. I definitely agree. I was actually saying that to someone recently. It's like, there's no way that we can support the demand if we're just doing individual therapy. And if you think about the communal way that we, in building community, having groups, conversations, I think that's definitely a way to go. A lot of people don't do groups though. So this definitely is an opportunity for people to think about, for therapists to think about, how do you include and do more groups in your practice? Jennifer asks, as a white female psychologist, how can I serve Black and other POC patients well? So open up the floor. Let's hear, what do you guys have? Hi, is that Yolanda? Go ahead.
Hi, Dr. Jackman. First, I want to just thank you for creating the platform to have these discussions. I
Thank
think they're really important. Um, I am not a psychologist, but I've been in the healthcare field for over 20 years now. I'm a practice administrator, so I work with a lot of physicians.
Yolanda, it's a little hard to hear you.
I'm sorry. Can you hear me now?
Yes.
Okay, sorry, my volume. I'm a practice administrator, so I work with a lot of clinicians
Okay.
and medical doctors and nurses on the administrative side, but really connected to the clinical aspect. I work in the community health center, so I'm able to see it from that perspective as well.
Mhm.
I think in the next few years, what we really need for the Black community is one, like you said, more awareness. People need to know that there are Black therapists and clinicians out there. I know for myself, being in a leadership position, I'm always advocating for our, particularly our community health center, to ascribe to getting more interns in training. I think that's the level that we have to really get
Mhm.
people more excited about mental health and more excited about just health and wellness overall. And you guys are doing, so much work, and it's a lot going on just with COVID that just added a whole nother layer. And I think that what needs to happen collectively is the people who are not therapists, like myself, have to advocate more to kind of streamline and bring clients in so that we can remove these taboos about just seeking therapy. So I think that's really, for me, being an administrator and being kind of immersed into healthcare and seeing where a lot of the funding is coming from, a lot of the funding is going. I think awareness, group therapy, just creating platforms like you're doing today is going to create more of a traction and more of a movement. And to go back to your first question of are we thriving?
Mhm.
I do agree with, is it Suchetta and also Alan as well. But on the flip side, I think it's happening incrementally. And I say this because I've been in healthcare for 20 years. And I think now there is more of a, not really a buzz, I don't want to use that term, but people are more aware. I have two children, two boys in particular, Black boys who are 20 and 24. So knowing 20 years ago where we were with their clinicians and, only my options when they said, okay, your son has ADHD, like they kind of label our children at a young age. And I, being a single mom and being kind of confused, like, and not really, my family wasn't born in this country. So coming here as an immigrant family and trying to understand, like, well, what do they mean my son has, something? He's a boy. He wants to climb a tree. He doesn't color in between the lines. So I think that right there kind of, made me like, oh, he has growth motor skills, but it doesn't mean like he can't comprehend. So I started being more involved in, like my children's education, but I think it's happening incrementally. And the one thing I just want to leave with that for me made me internally, realize that this stuff starts in the home. It's really important to uh, make our children and our families comfortable with expressing that mental health it's okay. I mean, we've all been through traumas just for the fact that half of us are dealing with, microaggressions and social determinants and all kind of things that, we deal with every day. And we continue to smile and go to work. But I think the one thing that, stood out to me, my youngest son, who is 20 now, he was in the third grade, very hyper, asthmatic, so was on the steroid, played baseball, basketball, football, all of those things. And the teacher said, no, on the third grade, he's not going to be able to do math. He can't tie his shoe. He needs special education, all of these things. And at that time, I'm saying, well, how and where are the services? But when I looked deeper, it was all middle-aged white women. There was not one, I could not find one Black psychologist. So now, fast forwarding to my son being 20 and both of my children being, involved in therapy as well as myself, I see more happening. So I think we are thriving incrementally. I think the change is happening slowly, but I think it's very important for us to keep this, what we're doing now. And I'm going to blast it on my social media and my LinkedIn, and just really start connecting. I know Alan just put out a charge for, people who want to be more involved. I think if we can all kind of connect this web, then we can make some more traction. I know that was long-winded, but I just wanted to say that. Thank you, guys.
No, thank you. I mean, there are a lot that you dropped in that message, and I do want to amplify the pipeline, the need for creating a pipeline of young people coming into the field. I went to talk to some college students last year at Framingham State, and they were all either African or from the African diaspora, some were Caribbean. And some of them wanted to study psychology, and they shared that their families told them, one, that doesn't exist, that's not a career, like actually told them not to do it, so they got a lot of negative messages. And so part of the conversation is, how do we help see for youth to see that is a viable option? One of my former interns has a mental health access program in Cambridge, where his work is about educating young people and getting them interested and excited about being in mental health professionals. There are some local universities who are also working to develop that pipeline. But it is so important because, what often happens, interns end up working where they intern or their postdoc, right? And so if your pool is limited, then you never get the experiences of having other kids, people of color or interns and fellows of color come through the network. So I really want to amplify that point because it is really, really essential. So how do you help promote mental health and psychology as a viable field? I think sometimes the old guard will talk about you can't make any money or we don't make money like we used to, but it is a very viable field. And for some people, in terms of financially, but it also helps to help people give back. And I see it as, like my own mission when I started was I wanted to help my community, right? From 15 years old, this is what I wanted to do, and to help people feel well and be well. So thank you for sharing, and thank you for sharing again your experience from practice management perspective. I loved hearing that. I think that you're the first practice manager who's been on our Zoom. So I really enjoy that perspective. I'd love to connect with you because I think that is, you've said you've been able to see over time. And we're definitely seeing, if we look at social media, people of color, Black folks, Black women, Black men, they're when I started this directory last year, I think there were only 2 or 3, and now there are over 20, right? There's Black Men Heal. There's so many different directories and spaces that's really advocating and supporting this work. So I am very excited about the future, and that people are the conversation is changing around mental health. But I'll stop talking because I want to make sure there's a lot happening in the chat. So, but any other people want to jump in and give a perspective?
I would love to jump in and give a perspective.
So I'll give you one. I do like to bring in any new voices, and I might put Dr. Mia on the spot because she is a clinical nurse practitioner. And so, we talk about just therapy, right? But then the medication piece, right? There's a lot of stigma around that. So I don't know, Dr. May, if there's anything you want to add to the conversation.
Yeah, absolutely. Yes, I am a psychiatric nurse practitioner, and I happen to also be a faculty. So I've had the awesome opportunity of working with, nurses at every level, from LPNs, and now I teach doctoral students. And as a faculty, there's such a shortage of people of color teaching. And I found my personal experience, I hear it all the time. How did you do this? How did you get there? And I think that we have to take responsibility to broaden our own network. We have to model what we want to see. You know, I just heard Dr. Jackson, right?
Jackman.
Jackman, Charmain Jackman, mentioned the mental health pandemic. How do we prepare the next generation to really be able to support the needs that we're going to see? I mean, there's already a shortage. And how do we help our own? Well, we have to show up, and we have to use our voices. And I think it's really good to speak to college students, but the juniors and the seniors who are figuring out, you know, where they're going to go and what they might anticipate doing, we have to catch them early. Like I have 4 kids, and my oldest, she wants to be a school psychologist. I think I may have had something to do with that. My 11-year-old wants to be a psychiatrist. I think I may have had something to do with that. So we have to expose them at a young age so that they're not fearful of mental health. So we have to equip them with enough knowledge of this is actually a good thing, and really get them excited about being a part of the solution. I think we focus a lot about what's missing, but what about getting excited about how do we fix it? And I do believe that everyone has a personal responsibility to teach someone else, to inform them, and to educate them on our own process and get them excited about being a part of that solution.
Yeah. Men, thank you so much. I knew you would have some wise words to say, and you did not disappoint. So yeah, that mentorship is so important, and we need to, we need to double ourselves, right? We need to replace ourselves twofold in order to try to catch up. So I can't believe it's 5:56. So this time was definitely too short, but I know we are back here every week till at least March. We'll be definitely for sure. Next week we have Dr. Jessica Smedley coming on. She is a psychologist in the DC area, and she'll be sharing her perspective and some of the work that she's doing nationally around Black mental health and healing as well. So I just want to appreciate you for being here. I'm just going to share all of you got here so you know how to get us. I'll just post our links in the chat, but if you have any last parting words, please feel free to post those in the chat. But I just thank you for being here and for being part of this conversation. And I think we'll have to think about a part 2, because this was definitely not enough time. But really some great ideas that were shared in the chat. So thank you all for being here. I'll quickly post my my information in the chat, but I look forward to continuing to have you guys engage and support our work. Thank you, everybody.